Hi everybody, this is Dr. Matthew Wheaton from Alicia Pet Care Center. I am coming to you today to discuss allergies in dogs. Skin infections are relatively simple. You'll identify a rash, there's potentially scabbing, sometimes it's moist, but it's relatively easy to diagnose. Bacterial skin infection and antibiotics usually do the trick pretty easily. We don't very commonly have fungal skin infections that are actionable, but occasionally we'll have a dog who gets a secondary malassezia infection. Malassezia is a yeast that normally grows on dogs, and occasionally it will overgrow in this situation. It's not that the dog has a primary yeast infection, by the way. This is a secondary issue to the underlying allergy, and it's not surprising that yeast would overgrow because you're just gonna have overgrowth of what's already there. There's various things to online or at your pet store to decrease carbohydrates or to help digestion better, and all of those things leading to a lower amount of yeast production. That's not going to do anything good. It's not about that. This is not something that's coming from the inside out. These are normal skin inhabitants. Malassezia is normally going to be on the skin of really every single dog in the United States or across the world, and it's not surprising for it to overgrow. On the ear infection, that can be a really challenging issue. Ear infections are almost always going to be secondary to an underlying allergy. And frequently the problem here is that you'll have a dog that goes into the vet and they get diagnosed with an ear infection, but there's no big discussion like this. And you have an itchy dog who's maybe licking their paws every day, but the owner doesn't really see it as itchiness, so they don't report it as itchiness. Nothing gets done about it, and the ear infection just keeps on coming back. That's where I think we can really let down our pets and our pet parents. We have to be really good as veterinarians to actually push this conversation along and to help y'all understand what you're looking at. But having a recurrent ear infection in an allergy dog is really kind of expected. But it's on us to recognize that there's an underlying issue and to explain that to you so that we stop that from happening. So, the second, third ear infection that you're going into your vet for, you should really be asking them, like, what do I do about the underlying allergy? Having that conversation about itch level and the various tools that we have in our toolbox to help mitigate those itchy dogs that keep getting ear infections. Some of those ear infections can be really bad and challenging. We can see three different things when we're talking about ear infections under the microscope. We see yeast, which is really common. Again, that's malassezia, and not surprising. It's very wimpy, easy to kill. We have cocci. Cocci are little round bacteria. 95% of the time, roughly, it's going to be an easy bacteria to kill. So you just need kind of like any antibiotic will typically kill this kind of stuff. And then we have rods. And rods are rod-shaped bacteria, but they include families of bacteria that are not good. Pseudomonas, E. coli, Klebsiella, MRSA for dogs, MERS-P. Various things that are much more likely to develop resistance and to have our antibiotics fail us because we're just randomly choosing them off the shelf. So if we see rods under the microscope, the ideal thing is to actually do a culture of that dog's ear. The culture will basically take the schmutz in the ear and put it on a petri dish. You put that in an oven at the lab. It's warmed up and cooked basically, and then the bacteria grows, and then it's tested with different antibiotics. So at the end of the 3 to 5 day test, they're going to come back to you and say, okay, we identified that there's E. coli in this dog's ear and it's sensitive to antibiotics A, B, and C, but it's resistant to all the other ones that we tested. And that's common. What we see is that there's multiple antibiotics that these rod ears will be resistant to, and that can be extremely frustrating if we don't look into that. It's kind of a challenging thing from the very beginning. You're either spending the money on the culture to get the right answer and then choose the right medication, so you don't waste your time, money, and effort on managing an ear infection that's not going to respond to antibiotics that you just randomly choose off the shelf. Or you randomly choose them off the shelf, you go through your treatment and realize that it's not working, and then you have to kind of pivot at the end, and that can be very frustrating because you just spent the time, money, and effort to get to the point of having 2 months of ear treatments being done that finally at the end we realize, okay, we're not going to win this battle, and now we have to regroup. So we always recommend a culture right off the bat so that we know what kind of medicine to use, and that's going to increase our success rate in managing the secondary ear infections. It's important to kind of keep an eye on the ears and to smell the ears occasionally. You could even put a Q-tip down in the canal a little bit and just get a sample of the ear debris. take a little sniff test of that. It shouldn't smell bad. If you're getting stuff out of the ears, by the way, it's like 9 out of 10 chance that your dog has an ear infection. And a skin infection's not going to necessarily seem like a skin infection to you, but a rash, hair loss, scabs, bumpy stuff, itchiness in the zone. So if you're scratching this area that looks a little bit weird and the dog is going crazy and like, you know, you're hitting the spot, that's generally going to be a skin infection as well. So those things need to be dealt with at the vet. They're going to be giving you some kind of medication to help your dog get through this issue. And I hope that this has been really helpful for you. If you have a question or you have comments, definitely hit us up here. And if you're in the area, of course, we'd love to see you. And we have 8 other wonderful doctors here that are very up to speed on the current approaches for all of our skin problems in dogs and cats. So we would be happy to help you as our new client. Okay, thank you. Have a good day.